Hey y'all, it's Dr. Becton. We're going to talk today about psychosis and affective disorders. We're specifically going to talk about how you differentiate schizophrenia, schizoaffective disorder, and bipolar disorder with psychotic features. So those are the three things that we're going to spend most of our time on today. When we're looking at a diagnosis of schizophrenia, that's the place where we're going to start. Schizophrenia requires that there are two or more of the symptoms present in criterion A. That's delusions, hallucinations, or disorganized speech. At least one of those must be present, and or disorganized behavior or negative symptoms. There must be a significant functional impairment, and the signs persist for at least 6 months and include at least 1 month of active phase symptoms. So this means that even though there might be prodromal phases and residual phases, we're really looking for at least a 1 month period where there are active phase symptoms. And you can look more in your DSM-5 to understand exactly what that means. That the schizophrenia is not better explained by a schizoaffective disorder or a bipolar disorder with psychotic features. So you'll note that that is particularly there in the diagnostic criterion. And in the presence of neurodiversity, such as an autism spectrum disorder or perhaps a communication disorder that developed in childhood, it is important for there to be a prominent experience of delusions and or hallucinations in order for the additional diagnosis of schizophrenia to be assigned. We're going to take a look at schizoaffective disorder next. And so you'll note that there is a kind of like blue hue to the back there. And that's, indicative of the presence of mood symptoms. And that can be clouded by experience of psychosis, particularly the criterion A symptoms of schizophrenia that we're going to talk about on the next slide. Now we'll turn our attention to page 104, where there are some descriptions about schizoaffective disorder. So a diagnosis of schizoaffective disorder requires that a major depressive episode or a manic episode occur concurrently with the active phase symptoms of schizophrenia, and that mood symptoms must also be present for a majority of the total duration of the active periods. So note that the things are concurrent. So they're occurring at the same time. It's not before or after, but actually concurrently. And this is an uninterrupted pattern of illness during which there's a major mood episode. So this is a depressive episode or a manic episode. And again, it's concurrent with criterion A of schizophrenia. And criterion A has a couple of parameters. It means that either delusions or hallucinations or disorganized speech has to be present. And there may also be the presence of disorganized behaviors or negative symptoms. As a note, when we're talking about the presence of a major depressive episode, the diagnostic feature of A1, that criterion, depressed mood, must also be present. So the delusions or hallucinations must be present for 2 or more weeks in the absence of major mood episodes during the lifetime of the illness. So whenever the mood disorder subsides, either the manic episode or the depressive episode has ceased, that the psychotic features would still be present for at least 2 weeks. That is what differentiates schizoaffective disorder. Symptoms that do not meet the criteria for a major mood episode are present for the majority of the total duration of the active or residual portion of the illness. So you'll note that the prodromal period is not included there. It must be the active or residual portion. And the disturbance is not attributable to the effects of a substance. And we'll need to specify with schizoaffective disorder if it's bipolar type. So this means that there is a presence of at least one manic episode as part of the presentation, or if it's depressive type where only major depressive episodes have been part of the symptom presentation. And I want to take a look at page 110 really quickly, but we're going to talk about this a little bit more on a later slide. But on page 110, it reads this. Specifically, schizoaffective disorder can be distinguished from a depressive or bipolar disorder with psychotic features based on the presence of prominent delusions and or hallucinations for at least 2 weeks in the absence of a major mood episode. By contrast, in depressive or bipolar disorder with psychotic features, the psychotic features primarily occur during the mood episode. So that's the difference. We're talking about the time where the psychotic features are present and the time where the mood symptoms are present. Because a relative proportion of mood symptoms to psychotic symptoms can change over time. In some cases, the diagnosis might actually need to change. So let's see if we can get this to go to the next slide here. Oh, looks like that's not going to work out for me, so I'll press the pause button. Thanks for participating in my station break here. I was able to get it to transition to the next slide after, hitting the pause button. Perhaps you took a break too. So when we're thinking about differentiating schizophrenia and schizoaffective disorder, it's really important for us to consider duration. Schizophrenia lasts for at least 6 months. You'll remember that from reading in your DSM-5, and includes at least 1 month of active phase symptoms. When we look at schizoaffective disorder, however, a mood episode and the active phase symptoms of schizophrenia occur together and were preceded and or followed by at least 2 weeks of delusions or hallucinations without prominent mood symptoms. So the mood symptoms had to be absent. When we look on page 107, we can see that criteria C for schizoaffective disorder specifies that the mood symptoms meeting criteria for a major depressive episode must be present for the majority of the duration of the active illness. And criteria C actually requires that we're assessing mood symptoms over time. What I want to fast forward to is the part where it says the clinician should review the total duration of this episode of psychosis, that illness, both the active and residual symptoms, and determine when the mood destabilizing symptoms were present. We want to consider if a person was on antidepressants or other mood stabilizers at the time, and how that was impacted or aligned with, or the temporal relationship between the effect of the medications and the psychotic symptoms, if that makes sense. The determination requires some significant historical information and significant clinical judgment. So if a person is on mood stabilizers and that's what's maintaining their mood, then you might be able to make some assumptions about the presence of a mood disorder if they're on antidepressants or something like that. And the example that they give is that an individual with a 4-year history of active and residual symptoms of schizophrenia might develop a depressive and manic episode that, taken together, don't occupy more than 1 year of their 4-year history of experiencing psychosis. This presentation would not allow the person to meet criteria C, which is required for the diagnosis. So now we're going to take a look at bipolar disorder. For a diagnosis of bipolar 1 disorder, it is necessary to meet the full criteria for a manic episode. The manic episode may have been preceded by and may even be followed by a hypomanic episode or a major depressive episode. In recording the name of the diagnosis of a bipolar disorder, things should be recorded in the following order. So bipolar 1 disorder, or perhaps even bipolar 2 disorder, the current or most recent episode, the severity or psychotic remission specifiers, followed by as many specifiers without codes as applied to the current or most recent episode. So as an example, you might code bipolar 2 disorder, current episode depressed, moderate severity with mixed features. Take a look at page 127 in your DSM-5 for specific information. For a diagnosis of bipolar 2 disorder, it is necessary to meet the criteria for a current or past hypomanic episode, and there must never have been a full manic episode. When we're coding bipolar 2 disorder, we explain everything with our words. However, the code remains 296.89 or F31.81. So I want to be clear about that. And actually, let's go back up to 296.4x and 296.5x. So 296.4 is for when there is a manic or hypomanic episode. That's the current or most recent. And 296.5 is when the current or most recent episode is depressive. Let's take a look at the difference between bipolar disorder with psychotic features and schizoaffective disorder bipolar type. So criteria B of schizoaffective disorder is designed to distinguish schizoaffective disorder from bipolar disorder with psychotic features. So you want to be sure that you're fully understanding that. We'll take a look at page 110 on the DSM-5. It reads this way. Schizoaffective disorder can be distinguished from a depressive or bipolar disorder with psychotic features based on the presence or prominence of delusions or hallucinations that last at least 2 weeks in the absence of a major mood episode. So in the absence of, that means the major mood episode is not present. In contrast, Or by contrast, in depressive or bipolar disorder with psychotic features, the psychotic features primarily occur during the mood episode. So they don't occur after the mood episode ends, but they occur concurrently with the mood episode. Because the relative proportion of mood to psychotic symptoms may change over time, the appropriate diagnosis may change from or to schizoaffective disorder. For example, a diagnosis of schizoaffective disorder for a severe and prominent major depressive episode lasting 3 months during the 6 months of a chronic psychotic illness would be changed to schizophrenia if active psychotic or prominent residual symptoms persist over several years without recurrence of another mood episode. So we always want to look at the temporal relationship between the symptoms in order to understand the symptom presentation. So this has been an overview, a supplement to what you've already learned about psychosis and affective disorders. I hope you find it helpful, and I'll see you online again soon.